when I'm thinking about anxiety, what are some of the actual symptoms of anxiety I should be looking out for, be concerned about in my child?
When you start to see patterns of behavior, patterns that really aren't typical of that child. I think when we start to see excessive irritability, some acting out, maybe you're getting more notes home from school. You're seeing some sleeplessness. You're seeing your child come in the door and, disappear for long periods of time. If you have a younger child and now we're dealing with bedwetting, when we already passed that developmental milestone or it's a little age inappropriate, those are things that really become more indicative of an issue. And our first recommendation is come and see a professional, someone who can help you differentiate between those symptoms that are more clinically impactful.
So again, it gets back into how persistent the anxiety is, and then how many problems that anxiety is causing, or its impact on its functionality. So
Correct.
relationships with other people, or maybe they will not be wanting to attend school anymore when normally they attend school. So changes in behavior and relationships are a
Correct.
big kind of red flag to look out for.
And I would say one other symptom with our older adolescent, that young adult, would be chemical dependency. We start to see some substance use that becomes more problematic. And again, we really see that impact in how they're functioning in school, peer relationships, family relationships, etc.
If I'm a parent and I think that my child is struggling with anxiety, what are some specific symptoms or things I should look out for?
We often see stomach aches, headaches, more somatic symptoms, physical symptoms, if you will. In our younger kids, you can get a sense that they're really overthinking things. So they're asking questions at a deeper level, or you feel that you've talked through something, they come back to you the next day with a different variation of that question. Very importantly, and we're going to talk about avoidance again, is that they're avoiding things that they would have done. So I used to go over and play with, little Sammy across the street, and now I'd rather just stay home in my room. So we start to see that they're withdrawing or pulling back from those things that they used to do. Some of those big red flags would be acting out, irritability, withdrawal that is very significant. For anyone who has raised a teenager, we've experienced the adolescent irritability, which is a very real thing. So that is a normal part of adolescence.
So the big thing to really look out for then in distinguishing kind of normal anxiety versus when you should seek treatment is how persistent it is, and then is it causing problems in either relationships or their functionality, like avoiding school.
So I think we both would like to thank the audience for listening, for spending this time with us, and the opportunity to pass on information and to hopefully help families engage in understanding anxiety disorders even more.